26 years ago, when I started Longevity Medical Clinic, the cutting edge factor was hormone replacement therapy, bioidentical hormone replacement therapy. But even then, we knew what many of our colleagues did not know. They were thinking that if you gave women bioidentical estrogens and men some testosterone, everything would be just fine. They were wrong. There are 8 hormones that are going downhill as you age, and all 8 of those hormones are important. So what we do when someone came in, or comes in still, we measure 8 different hormone levels. And our goal is not normal for your age, because normal for your age stinks. Normal for your age means that things are going downhill at the usual and accustomed rate. And so if your goal in life is to get slow, weak, fat, dumb, and sexless, then fine, you don't need Longevity Medical Clinic. On the other hand, if you don't like what time and gravity are doing to you, if you would like to be stronger, faster, leaner, smarter, sexier, and happier, well, then we need to do something about what's happening to your hormones. Back in 1998, when I started this clinic, we thought that would be enough. We know it's not. We now know that there are 12 different factors we have to take a look at, and that's what we do now. But this little video, I'm going to be concentrating on the most basic, that is the hormone therapies. Testosterone, dehydroepiandrosterone, progesterone, estradiol, pregnenolone, thyroid hormones, growth hormone, cortisol levels are all changing as you age. All but cortisol are going downhill. Cortisol may be going up because you have so much chronic inflammation, or cortisol can be going down because your adrenals are exhausted. So that one we have to take a close look at. If it's too high, we need to get rid of the inflammation and let it come down. If it's too low, we need to find ways to resuscitate those adrenals so they function appropriately. Well, let's kind of go through the list and talk about what's happening to you as they go down and what we can do about it. And I'm going to start with testosterone. Now, testosterone isn't the only one that drops, but it is the primary steroid hormone in men and women, and that fact is often lost. Okay? Women's breast cancer risk rises as their steroid hormone levels are dropping, and it appears from the latest data that the most protective of those hormones for a woman for breast cancer is testosterone. If we can give a woman back testosterone early enough, we can cut her risk of breast cancer from the normal range by 50 of 320 cases per 100,000 women years to only about 50 cases per 100,000 women years. So that's a dramatic drop in risk. We don't take the risk to zero. There are people that are genetically predisposed, but we can lower their risk dramatically. A more common thing to look at is drive, ambition, self-confidence, stress tolerance. As your testosterone level is dropping, men and women, your bones get more fragile. You don't tolerate stress and anxiety as well as you used to. You kind of get discouraged by life. You get a dour, a quasi-depressed sort of philosophy. You start looking at the negative side instead of the upside. It's the inverse of that 17, 18-year-old that is confident they can conquer the world. Well, by most of us in our 50s, 60s, 70s, 80s feel the world has conquered us. And part of that is drop in testosterone, and we need to get it back up. DHEA, another anabolic hormone. It's a precursor to testosterone, as well as a precursor to estrogen, progesterone, and cortisol. But dehydroepiandrosterone is made in our adrenals. Our levels for a man when he's in his youth is up to about 500. By the time they're 50 or 60 years old, we often see it at 150 or 200. The levels for a woman should be between 200 and 400. We see women down at 75 to 100 by the time they're in late life, and that's just not acceptable. Progesterone is protective against breast cancer. It slows the growth of most breast cancers, in fact, but it also slows the growth of prostate size. It protects your prostate against enlargement. It also makes your skin a whole lot prettier. You know, one of the things that happens as we age is we look old, And that's because our skin is thinning out, it's sagging and losing its elasticity. It doesn't spring back into shape, it sags. So progesterone helps protect you from getting that saggy skin and wrinkles. You don't need your Botox as early in life. Estradiol slows bone loss, and with testosterone to stimulate bone growth and estradiol to inhibit bone loss, we see our older women actually getting thicker, stronger, denser bones over time. And it's not the artificial hardness that you get with the drugs. It's actually healthy, great bone. Estradiol also restores a woman's verbal skills, and it's a potent systemic anti-inflammatory. It decreases the risk of heart attacks and strokes and colon cancer. It makes the skin smooth and vital. It helps you to heal rapidly with minimal scarring, and that's true with men and women, by the way. When I have a man who's going to have a major surgery, I often get him a little estrogen cream to put on the wound as soon as it's closed, and it helps it to heal with minimal scarring. So, unless you're a guy who wants to look tough from a lot of scars. Personally, I've got a lot of scars, but they were from old gunshot and shrapnel wounds in my foolish youth. Pregnenolone is a precursor hormone, but it helps you to sleep well, it helps you to tolerate stress, it helps to alleviate anxiety, and it also decreases the inflammatory changes that occur with autoimmune diseases, thyroiditis, lupus, all those sorts of things. You can decrease that pain and swelling and degeneration by just raising your pregnenolone levels. Thyroid hormones are involved in speed, energy, mental and physical energy. Makes your brain work faster so you don't get sluggish. It helps you burn more calories in the course of a day. Now, we're not trying to make you hyperthyroid. We're not kicking your levels abnormally high for a young person, but I want them in the mid-range for a healthy young person. I like that TSH, where the normal range is from 0.4 to 5.4. I want it about 1. So you've got plenty of thyroid circulating that helps you to burn calories and be energetic and get out and move and think fast and react quickly. And then growth hormone levels. Growth hormone allows you to heal and grow and repair tissue. And as your growth hormone levels are declining, you slow down your healing and repair, and you become less and less competent to grow new tissue. That's what growth hormone is all about. Now, here in Washington State, we have some significant limits on what we can do with growth hormone. And that's because our medical board ignores the federal courts on matters of federal law. And they think that helping an elderly person so they can get up out of their chair and climb stairs is the equivalent of helping bodybuilders make muscle on top of their muscle, which is foolish. There's nothing wrong with helping older people be strong enough to lead their own life, but our board apparently wants you to fall apart. So what we can do is, if you really need growth hormone, which about 2 or 3% of you definitely will, we're making arrangements for you to get it from doctors outside of Washington State in the rest of the country, which the rest of the country recognizes federal law and science and allows the doctors to write growth hormone. So we have a list of doctors in other states that can help you. At any rate, the last one is cortisol. Now, cortisol is an adrenal steroid. It's made in abundance if you have a sudden injury or sudden stressor in your life. And in those cases, it actually brings in white blood cells to the area, helps you to get rid of the damaged tissue and heal and repair. It also calms you down and keeps you from panicking when you have a serious injury. The other side of the coin is that if you have chronically elevated cortisol levels because you are under stress that won't go away, then your cortisol levels stay high. And in that situation, they thin out your bones, they make your muscles weak, they predispose you to a wide variety of infections, both bacterial and viral. They decrease your ability to find and kill cancers, and they trigger cataracts as well as accelerating brain shrinkage. So we don't want chronically high cortisol levels, and that means we need to decrease your inflammatory changes, which we do at Longevity. So Longevity Medical Clinic, we address all 8 hormone levels. It doesn't make you younger, but it gives you a metabolic advantage over people who have declining hormone levels. Okay? I'm 76 years old. I run, jump, leap, cavort, dance into the evenings. My last child was born when I was 65 years old, and I'm having a great life. But I do it because I have the hormone balance of a 25-year-old, not just testosterone. All of my hormones are in the range of a 25-year-old man. Didn't make me 25. You see the white hair, folks. So, no, I am a 76-year-old man. I've lived 76 years. We have not warped space and time and made me younger, but I've got a far more active, vigorous, productive life than most men my age. And part of that is we have not allowed my hormones to decline in the, quote, normal manner. Now, come to Longevity Medical Clinic if you'd like, and our doctors will be happy to put you in the same shape I am. I wish I could, well, why don't I? Here is me at age 50. At this point, put in the fat Jerry in a chair. And then here is me with my wife and daughter on my 76th birthday. And you can put that picture up side by side. Look at the two of these side by side. You see the difference in a 50-year-old with normal hormone balance and a 76-year-old with a 25-year-old level of hormones. Now, admittedly, we are addressing all 12 of my factors, not just the hormones. So if you want to come to Longevity, we will address all 12 of the age-related declines, the things you need to look at, the things you need to do to stay strong, fast, lean, smart, sexy, and happy. I hope we see you at the clinic. Next video is going to be on stem cell senescence.